Bismillahirrahmanirrahim. Assalamu alaikum. In my vlog on food allergy, I had mentioned that there's a role of breastfeeding in the food allergy. And in the today's vlog, we shall see what are the benefits of breastfeeding in reducing food allergy and why we say that breastfeeding is a protective way of reducing chances of food allergy. What are the studies which support that breastfeeding has got role in reducing food allergy? We will have an overview of that, and of course, in the light of these, we shall try to develop some recommendation that how the mother should go about the breastfeeding to reduce the chances of food allergy of his uh, um, son or daughter in the adult life. So be with me in this vlog. We shall get answers for all these questions. As mentioned in the intro, today we will see the role of breastfeeding in food allergy. It's good to know that breastfeeding plays a significant role in reducing the risk of food allergies in infants. And why I say it's because there is many benefits of breastfeeding in reducing food allergy risk. Number one, immune system development. Milk breast contains immunoglobulins which help develop the infant's immune system and reduce the risk of allergic reactions. So the first way how the breastfeeding reduces the food allergy is the immune system development. The second way is, or the second mechanism is gut microbiome establishment. Breast milk promotes the growth of beneficial gut bacteria, which aids in the development of tolerance to food antigens. So this is the second mechanism. The third mechanism is allergen introduction. And what do I mean by allergen introduction? Breast milk contains small amounts of allergens from the mother's diet, which helps introduce these allergens to the infant's immune system in a controlled manner. And the fourth mechanism is anti-inflammatory effects. Breast milk contains anti-inflammatory compounds that may help reduce inflammation and prevent allergic reactions. So these are the four main mechanisms with the help of which the breastfeeding reduces food allergy risk. Number one, immune system development. Number two, gut microbiome establishment. Number three, allergen introduction. And number four, anti-inflammatory effects of the milk. What are the studies which have supported the breastfeeding role in reducing food allergy? I would like to mention two recent studies. One study published in 2018 in the Journal of Pediatrics, and that study found that exclusive breastfeeding for 3 to 4 months, even for 3 to 4 months, reduces the risk of peanut allergy by 50%. Another study published in 2019, it was a meta-analysis, and which was published in the Journal of Allergy and Clinical Immunology. It found that breastfeeding for at least 4 months reduces the risk of food allergy by 24%. And what that are Quranic instructions are to breastfeed your child, your infant, from 2 years to 2.5 years. So wow, what a great protection. So therefore, we should advocate the breastfeeding, because this is the integral and natural way of how our infants, they are introduced to the world, how they are living in the world, because food is the only fact which it is the relationship which our body has with the environment. So if I go for the recommendations of these studies, the literature, our Islamic recommendations are 2 to 2.5 years minimum. But the benefit which we are getting, and which has been established even medically without going into the religious component of it, exclusive breastfeeding for at least 4 to 6 months. And then it should be ideally continued along with solid food introduction. Avoid unnecessary dietary restrictions during breastfeeding, and gradual introduction of solid foods, including common allergens, under medical supervision. But remember, saying all this, breastfeeding is not a guarantee against food allergies, but this is the most strong natural protector, but it's not a guarantee. But by and large, it reduces the risk. Some infants may still develop food allergies despite breastfeeding. That may be some other conditions. And better, if you're suspecting food allergy of your infant, or your other children, they were having food allergy, consult a healthcare professional for personalized advice on breastfeeding and food allergy prevention. So my dear viewers, today we explored the role of breastfeeding in reducing the risk of food allergy, and it's also our religious teachings that we should encourage, we should ensure the breastfeeding for our infants. In addition to this food allergy risk reduction, there are so many other benefits of that as well. We can discuss this in some other and at some other occasion, but the fact is that breastfeeding has a definite role in reducing food allergies. Take care. Thank you. Khuda Hafiz.